Pleural disorders. Introduction. The pleural space is normally filled with a small amount of fluid. Select true or false. Correct. This fluid helps the two layers of the pleura glide smoothly past each other as you breathe in and out. Hank is experiencing sharp pain in his chest. He also feels tired and short of breath. Should Hank contact his healthcare provider? Select yes or no. Correct. Sharp chest pain, tiredness, and shortness of breath may be signs of a problem. Hank should contact his healthcare provider. Extra fluid in the pleural space may cause a lung to collapse and make it hard to breathe. Select true or false. Correct. A pleural effusion can cause a lung to collapse and make it hard to breathe. Pneumothorax can be caused by which of the following? Choose one of the following options. 1. Certain lung procedures. 2. Lung disease. 3. Lung injury. 4. All of the above. Correct. A hemothorax is when blood builds up in the pleural space. Select true or false. Correct. The blood can put pressure on the lungs and cause a lung to collapse. It can also cause shock. Treatment for pleural disorders focuses on relieving symptoms, removing fluid, air, or blood from the pleural space, and treating any underlying conditions. Select true or false. Correct. Talk to your healthcare provider to learn more about treatment for pleural disorders. Thank you for using Explain.